So thank you. High benchmark to kind of jump over. I guess I have to add some kind of value now. So my hope is that you walk away from the learnings we've had at CSL Behring. It's been a journey for us, and if I can help you in your journey, you'll let me know. Obviously, the idea here is to tell you about what we've done to unlock value in our omnichannel efforts. I'm giving you my email. If I can help you do it in your organization, you'll let me know. Building on the idea of partnership and networking, people have helped me. I would be happy to help you. We're going to talk about what we've done. It's important to note that we've done some things that I think are just common sense, right? We don't have a MarTech stack. There's no Salesforce in our organization. We've just developed some channels, connected them to our platform that our sales people use, and we're starting to unlock value from doing that. And so again, I hope you can understand what we're doing. Let's jump in and talk a little bit more about the agenda. I'm going to give you a framework, our North Star. We call it orchestrated customer experience, what we're trying to create. We're not there yet, but that's what we're trying to do. And then we're going to talk about all the channels that we've created on 24, an events platform for webinars, symposia. We have a global events agency, Eversana, that helps us execute that platform. We also have an Inksmail, marketing triggered email platform, and then our content source, ProMat's DAM, very important. And if you fall asleep during the slides, there's an executive summary at the end that you can take a picture of for all the learnings I'm going to take you through, and then we'll talk a little bit about our future plans. So what is orchestrated customer experience? It's really not that complicated, right? Everyone's got a data warehouse, right, in their company, right? Well, we've done that in ours, and we've connected them so our customers are better understood by our customer-facing functions, right? So we now know your prescribing habits. We know your demographics. That helps us get a better understanding of the insights needed to market to our customers. And this is true for physicians, and eventually we'll do it for patients. But it's also important to communicate in the preferred channels that those physicians want to hear information in. You may like email. I like text, right? We want to make sure we're communicating in the channels that they prefer. And we also want to give them content that both informs and eventually persuades them to use our products more, right? This is the idea behind orchestrated customer experience. We're not there yet, but we're on the road. What we've done about, I guess, 4 years ago, we launched Viva CRM. I'm sure everyone's familiar with that platform. It's used across all of our affiliates. So we've actually have all 38 on the Viva platform across 20 brands. So now we're communicating in the same way consistently, and that also allows us to do rep-triggered emails, RTEs. We built what I'll call a very small foundation. We started with On24, our events platform, and we put Eversana with them. And importantly, all the data that you'll see later flows into Viva CRM, so our Salesforce knows what our customers do in those events. We also have our DAM, which we'll get into. That's my favorite acronym ever in marketing. Digital asset management, right? It's a very important point. Content is king. It's really important. And so we have a way now we can share content where we couldn't before. If you worked in one of those 38 countries and you wanted content from another, you couldn't do it. We changed that. So people now are reusing content, which is saving us a lot of money. And then Inksmail, a marketing triggered email platform, really doesn't matter which one you use. We happen to use Inksmail. But the idea of using mass market emails is a very effective tool that you'll see how our customers are reacting. And this all started about 18 months ago. So I'm going to share with you the results. We find them encouraging, hopefully you will as well, but we're starting to see impact from these efforts. So what has the impact been? Well, across the different channels, we hoped all of our regions would use it. Didn't happen, right? We tried to get everyone on board, and it's optional, so we couldn't demand that people use these platforms, but many of them did. And On24, as an example, we had 8 affiliates using it. And importantly, we generated like 560 customers in those events. 300 of them are new. So we're starting to create new account opportunities for our sales force, and we're doing it cost effectively because Eversana is very, very, very affordable. Inksmail, we have about half of our affiliates on it. But importantly, the number of physicians went from 5,000 to 22,000 that have opted in to receive emails. Big marketing opportunity. And then our DAM, we saved a lot of money. We have 22% of our content being reused versus created from scratch. That's about $3.5 million in savings for us. And because you're reusing content, it goes faster through MLR, and we get approval quicker, which marketers love. On24, it's called that because it's on 24 hours, right? It's a platform that allows you to watch a live event, but if you can't make it, it's also on demand, like Netflix, right? If you're there, the movies on Netflix, you probably wouldn't watch it, right? But we can do it anytime we want. Same thing for On24. And the reason we had this event platform is because the research indicates That's what customers want. They want to understand, product information through their peers. On24 gives them that option to do that. And we know it's an important channel. We partnered with them for a lot of reasons, one of which they understand life sciences. They've been doing it for decades, and they really understand our category, and they're working with other competitors that they've learned from. So we didn't want to recreate the wheel. They understand our industry and have done this for quite some time. This is what, if you remember the pandemic, how many people use Teams and Zoom in the room? Lots of people, right? Yeah, I do too. It's a terrible platform for customers because it's very didactic. You see a bunch of faces, maybe you share your screen, but that's it, right? On24 is far more engaging. This is what it looks like, right? It has windows for different needs. You can ask polls and surveys. Customers can ask questions, right? We can actually have them download content. We get them more engaged. That's the purpose of the platform. A higher engaged physician tends to use your product more. And so we're trying to get all our physicians engaged. This is the platform that helps us do that. So how does it work? Well, it's not that complicated. Our reps, they send emails to their customers with a link to the event. They register, and that registration is captured in Viva. And when they attend, importantly, all the data in that event is captured at the customer level. So I know a physician's questions. I know how they respond to polls and surveys. I even know how engaged they were because we calculate an engagement score. Why is that important? Well, when a rep sees that data, they go to the customers that are most engaged first. And when they go, they know what the customer did in the event. Oh, you clicked on safety. Let me show you a new study that we just learned has interest, much safer product than you already thought, Mr. Doctor, right? And so that's the idea. We're informing our reps with the data from the event. That's also true for on-demand. And that's an important channel because on-demand events, if you ask customers, they always want to come to a live event, but things come up, right? We all have those challenges. Having an on-demand version allows you to actually have the same content with the same data, and they can watch it whenever they want to. And about half of physicians really want an on-demand version. So that's why we did it. We also are using it for training. Our medical affairs department trains a lot of HCPs on how to infuse our products, right? They're self-infusion often. This is a great platform. Try to, teach someone how to inject or infuse themselves, and while talking to them on a Teams meeting, very hard to do. Different cameras allows you to teach better. And so we're seeing our engagement of these people that are actually attending getting better. And importantly, we know which people in field medical are doing a good job training because the one with the highest engagement scores are the ones that are training our physicians the best. Eversana, same story. It's a global events, well, I should say a global agency that happens to do events for us. Why are they important? Well, they have boots on the ground in every affiliate that we compete in. If you're in France, you want to speak French, they have someone in their account team that speaks French because they're located in France, right? So we have a global opportunity to better meet our needs for our marketers by meeting them where they are. And they also have a lot of experience in life sciences and do a lot of work in the medical arena. Our partnership On24, Eversana, and CSL is really important. Why? Well, it's one-stop shop. If you're a marketer, if you want to plan a webinar, you want to make it easy. This makes it easy. They handle everything soup to nuts. They also do non-personal promotion, which we're finding is attracting a lot of our new customers, right? And importantly, you'll see in a moment, they built a medical expert portal that all of our affiliates around the world are using that are integrating all these channels and really informing customers in a much more persuasive way. This is the dimension of what they do for an event. You want to train your speaker, you want to create slides, you want to put a registration page, Eversana does it for you. You need production for a live event, you want to coordinate speakers in the event, Eversana does it for you. You want to create an on-demand event, Eversana, right? So the idea is one-stop shop. The marketer calls them, they handle it from there, and it's very easy and executing very well. So that's an important piece. Making it easy for a marketer, very important. They also do non-personal promotion, right? We spend a lot of money in LinkedIn and paid search to drive customers to these events, and we retarget them when they come to a registration page and don't register. Eversana does that for our affiliates. So it's all in one house that they can actually execute pretty well. This is a kind of a top line of our results. We've found that we've actually reached 1,000 physicians in a pretty short period of time. That have registered for these events, right? So we're starting to see the scale impact because it's all done digitally. All these physicians are being reached out through non-personal promotion, and our sales reps, sometimes invitations, go out, but it's really been able to be a larger impact than maybe we even thought initially. We're also doing it cheaper, right? Because you use Eversana, you don't have to pay for an agency's event platform. It's on 24s, and it's much cheaper. Affiliates that are using Eversana are saving about 30% in agency costs. And importantly, we're attracting new customers in a very cost-effective way. Rare disease, the patient profitability is quite large. Getting a 400 acquisition cost per physician is very good. And so we're seeing all of these things kind of work in harmony. And obviously the quotes at the bottom are testimonials from some of our marketers that have seen this work in their country. So you may be asking, well, 8 out of 38, that's not good. You're right. It's not good. We have 30 affiliates that aren't using the platform. What are we doing? Well, we're trying to create ways and an operating model that allows them to do it where they are, which is related to the cost, right? A lot of these affiliates, if you're in Hungary, you don't have a lot of marketing dollars. So you have to offer something for those affiliates that are low resource. So we call it see, try, do. See Eversana do one, try it with on 24 resources, and then do it by yourself, right? That's about $20,000 for the see, try step. But once you've seen it and tried it, you can do it by yourself, and you have unlimited events. We have the event buffet. You can use as many as you want because we have a large global contract that allows these affiliates to do events very cheaply. And all they got to do is pay $6,000 for a login. We've also built resources that teach people. Hey, you want to learn how to use On24? Watch the video. You want some templates to recreate a registration page? Use the one that we've already created. We make it easy for our marketers to execute, which at the end of the day is really important for a marketer. This is the portal that I mentioned earlier. This is our one-stop shop for all of our therapeutic areas. We're in 5 around the world. And if you're a HCP, this is where you go to learn about CSL products and disease states that we compete in. And it's in your local language. So if you're in France, we have a French execution of the website. And it's really important because this is where everything is going to go eventually for us. What we're doing is actually having both medical and promotional content that's firewalled appropriately, so no compliance issues. And again, making sure that it's easy for our customers to learn about our products. We use non-personal promotion to get people to register on the site, right? And we give them a customized experience. We have all of our on-demand, on-24 event videos on the site so you can watch the content that makes sense for you. And then we recommend, like Netflix, the next best content that should advance their understanding of our products. And we use personalized emails with Inksmail that reflect what you watched. So we know your experience, and we try to improve it with personalization in these emails. So it's all connected together. Again, same channels, but now it's housed in a website. These are the measurements we use. We've been up and running for about 6 months. We're exceeding our benchmarks, so we're encouraged initially by the results. And our affiliates have the ability to see any data they want. You want it at the specialty level, you want to know what content you're being clicked on, you want to know the brand you're working on. It's all there, and it's all self-service. Inksmail, no big deal here, but again, the data says email is a good channel. People want to be communicating in email. It's there whenever they need, and this data supports that. And I think many of our customers would tell you that if you see the open rates, very, very high. Inksmail is no special platform. It could be anything. There's a lot of them out there. But what it does is allows you as a marketer to create emails without knowing how to code in HTML. Does anyone know how to code in HTML? I certainly, well, I'm impressed. I'm going to talk to you at the break. Very impressed. That's not easy to do, right? Even with AI. So we make it easy, and importantly, it's integrated with Viva. You opt out of Viva, you get opted out of Inksmail. So our customer experience is connected. Very, very important. The data needs to be connected to the customer-facing platform that you have. We have a lot more opt-ins, I mentioned earlier, and a lot more affiliates using it. We had 5, 6 months ago, now we have 20. Why? It's free. You want to use it, we create an instance for you. You want to send a few emails, it's a few $1,000. It's easy and free, very important. And it's also interesting to note that a lot of customers have opted in. We get 5,000, 6 months ago, now we have 22,000. So a lot more customers are opted in, which allows us to now expand their scale and impact of what we built. Freedom Promo DAM. Real quick, you know, I'm assuming everyone knows what a DAM is. It's where you house content, right? We had to relaunch our DAM. We didn't do it the right way the first time. And we spent a lot of money training marketers, agencies, MLR teams. I think we had like 2,000 people going through our training programs. And we measured, hey, do you understand what a DAM is? Do you understand the capabilities we're giving you? And they did. 80% or better said, yeah, I get it. I understand it. And now we're really focusing on adoption. Are you reusing? If you understand it, you better be reusing content, right? Instead of creating it. And when you create it correctly. That's what we're focused on now. We seem to be doing well in this area. Again, it's only 18 months in, but we're seeing a lot of people reusing content because it's easy. It's easy. As a marketer, if you don't have to spend money on something like that, you don't, right? And this is what we're seeing, about $3.5 million in savings, faster MLR times. We're not as good on these source documents from our agencies, nothing against agencies, but they're not incentivized to give us all the stuff that they have because they make more money if someone calls, could you have that? So we're gonna do a better job of getting our source files, all their creative packages, but that's kind of where we are today. How are we gonna do that? Well, we're gonna hire an external librarian. We have about 150 agencies globally, so we have to police them, right? We have to make sure they know what the expectation is and also kind of what we're seeing. And so we're gonna make sure that they understand this is the expectation. If you're not meeting it, well, you're gonna be on the bad list versus the good list. And we produce monthly KPIs. Everyone knows who's happy and who's sad because we tell them. And that's very, very important in the success of this. And we're gonna centralize image purchasing, which is gonna save several $1 million as well, because today affiliates buy their own images at the local level, not globally. So, okay, wake up. This is the executive summary. This is the summary of all the things I just told you. And it's not rocket science. It really isn't, right? Focus, reuse, and a couple channels. I don't care where you are in your maturity of Omnichannel. Anyone can do that. We did it. We didn't have anything 18 months ago. It's not hard. Just focus, though. Second, make sure you partner with a global full-service agency. It makes your life a lot easier. And they handle a lot of the issues that come up because they're in the regions where these issues are being created. The operating model, make sure it services all of the affiliates. Even if you're just in the US, you have different brand resources. You know, brands, they spend more money on certain brands. Make sure you can support any brand's P&L with every resources that they have. Also, make sure everything's integrated. It's very important. You know, you do something on Teams and Zoom, it may be free, but you don't learn anything about your customer. Having that data flow into Viva CRM is very powerful for our sales reps. Make sure you can scale globally at low cost. Very important. Don't think about the immediate pilot. Think about what's going to happen after. The KPI is critical. Monthly distribution of the happy and sad list. Very important. And then lastly, make sure you're leveraging these channels in anything you do. It's not hard to leverage them. You just got to think about it in advance. All right, quick snapshot for future plans, and then we'll talk of any questions that anyone has. Real quick, as I mentioned, we're not terribly happy with our adoption, right? 20% of our affiliates using On24, that's not good. 50% Inksmail, that's okay. But we got to get more and more of these to use these platforms because it really is in their best interest. But many people have existing relationships with agencies. Oh, I trust them. I'm not going to use, I don't know, Eversana, right? So what we're trying to do is encourage them to do it. How? Well, the first thing we're going to do is we're going to add a widget, say book a meeting in the event. So now when customers come to the event, they can request a sales rep to visit them. That's going to incentivize a lot of affiliates because now it's new business that we're creating, right? The opportunity is, doc comes in, wow, that's really great. I think I have a patient. And they get a call. So they're going to have the reps meet them after they click on this request a meeting. We're also rolling out and piloting a thing called marketing operations, which is a fancy term for saying execution. We're going to help those affiliates that can't afford people to do it. We're going to give them the people. And it's very cheap. We're a central resource that helps them execute. You want to do a webinar? We help you do it. And it's basically for free. So we think we're going to get a lot of adoption. And we're going to make sure that when someone attends a webinar, that sales rep knows they requested a meeting. That's going to incentivize these affiliates to jump on board because now they're getting new business. We also created some best practices with non-personal promotion. Give me 15 grand in 8 weeks, I'll send you new customers too. And that will come to the rep as well. We're also going to make sure we use Inksmail and rent email lists, very cheap, $3,000. Who can't afford that? To go out and get new customers come to these events. And if they don't come to the live event, it's on demand. We're going to help you create an on-demand version so that lives in perpetuity. And then lastly, we're also going to make sure that when customers register on our medical portal, we know if they're new. because they have to give us information, and we send that new account to our sales force as well. Last slide, and then we'll open up for questions. We're also resourcing this idea better than we have. It's been me up until now. We're going to add a couple of people focusing on content across not just marketing, medical, and market access. And there's an omnichannel person that we're also going to be adding to the mix that's going to help us really get to that Salesforce kind of idea of whatever we choose to do in a way that really unleashes even more value. So with that, I'll say thank you, ask you any questions. And again, if I can be of help with my colleagues and the partners that I have, here are their emails. Thank you.
All right, amazing, Stuart. What questions do we have?
Hi, Ilona Ritok, Spectrum Science. You mentioned that you run variety of different channels in US and outside of US, as well as content. Do you find that there is a difference in the type of content and the type of channels that perform better in the US versus outside US, and how do you solve for it?
Yeah, it's a good question. I don't have enough experience to say we're seeing differences yet, because we're only using a couple channels, as I mentioned. I will tell you on non-personal, we're seeing pretty consistent results. LinkedIn, great channel to recruit physicians because you can target, right? Paid search, another one. I mean, those are the two channels that we're finding consistently of value. The content doesn't change dramatically. We're seeing countries using affiliates, different content all the time. And because as we get smarter about how we come to market with our launches, as an example, we create core content, and then that gets distributed throughout all of the affiliates that they localize and get approval. But the content isn't that different. I don't think physicians are that different across the globe, and I don't think our content is either.
Hi. My question is a little bit like two parts. Oh, sorry, Melissa Gordon-Ring, IPG Media Brands. This is incredible, by the way. I think it's amazing. I do have, as I said, kind of a two-part question. One, you said it's basically you who's been doing this, along with a few partners. What were your biggest challenges? And secondly, you talked about adoption rates and kind of not and encouraging people. How come this was an encouragement, not a requirement?
Yeah, good questions. The second question is probably more relevant. In a decentralized organization that we operate in, where everyone owns a separate P&L at the local affiliate level, it's very hard to mandate things. Because once you mandate it, it better work or you're kind of in trouble. And so what we've taken a different approach is we say, hey, there's some carrots that you should be using. Do you want your sales reps to understand what a customer does in an event? I know you're using Teams, but it's not that expensive. And we're saving your money, actually, for the people that are using it. And so what we're finding is the adoption and the confidence. We talked about trust earlier. That's really important. They're trusting Eversana. They didn't even know, they couldn't even spell Eversana before. Now they know that they can do these things and the word's getting out, and that's how the adoption grows. The first question, I apologize, is, would you mind repeating?
So you said that you were really doing this on your own.
Yeah. So the biggest partner I have is our technology partners internally. We call it INT, but they're the techies that make sure the data gets integrated, right? I kind of know what I want, but they actually make it happen. They're an important partner, and the agencies, Eversana, On24, to probably the bigger than Inksmail, are really important as well. We meet every week and we talk about what we're doing and how it's going and what are the challenges. I mean, if you ever worked on events, devices, oh my God, it doesn't work, I can't get connected. So we have ways to solve these problems, and we've been pretty good at developing solutions to problems that we see.
All right, we got time for one final question. All right, thank you, Stuart.